Good morning, everyone. Hope you're having a great day. I just thought I'd jump on and talk about some work I do with a neurologist with functional neurological disorders. So what that is when you go along, you're experiencing some symptoms, like you might have dizziness or paralysis or symptoms of a stroke. Anyway, there are symptoms that are similar to having some sort of brain disorder. So you go along to your neurologist and he diagnoses you and then tells you, well, there's nothing wrong with you. And you say, well, hang on a minute, don't you believe me? I'm experiencing all these symptoms. There's got to be something wrong with me. And he says, no, there's not. You've got a functional neurological disorder. It's all in your mind. So the patient becomes very angry and says, well, you don't really believe me, you're not treating this seriously. And typically that's how functional neurological disorders were treated. And you kind of need that diagnosis because it could be the physical symptoms. So anyway, I get to work with these patients and they're referred to me to work on what's really going on, what the cause is. And so the first explanation I use is that of a placebo. So it's like, well, you know how a placebo works, right? You know, you take a sugar pill and it has the same effect as, say, a headache pill. In clinical trials, there's very little difference. So why does the placebo work? And, you might say, well, because you believe it'll work. Yes, but you don't know you're taking a sugar pill. So where do you believe this? Well, it's in your subconscious, you might say, because you just assume that you're taking a pill that is going to cure your headache, so it cures your headache. So that's really fascinating. It's in your subconscious beliefs. So then, why does a nocebo effect, which is the negative symptoms of a drug, why do you experience those? Well, it's the same explanation. They work because you believe that they will, in your subconscious, you believe you'll experience some negative effects of the drug. So a functional neurological disorder is very, very similar in that when something happens, like you might be undergoing a lot of stress or anxiety, and then something happens, and so, hi there, and then you experience some form of memory loss, or you might experience some numbness in your leg, and then the numbness reinforces this belief that there's something wrong with me. And then once you have this belief, you're then focused on your leg, on the symptoms of it, which reinforces the belief, which reinforces the symptoms, which reinforces the belief. So then your attention on the symptoms sort of creates this as real, which is really fascinating, because if you think about it, we all have these functional neurological disorders going on to different levels. One guy I've been working with recently, he came in because he has memory loss. In fact, it's so bad he can't remember what happened the next day. And so then when we delved deeper, we found out that when he was young and he did something wrong, or did something that he didn't do his jobs, or something he was supposed to do, he was sent to his room. Found it very, very unfair. He was crying, expressing his emotion, and then he was punished for expressing his emotion, locked in his room for a day. So he learned very quickly not to express his emotion, and so then from that moment on, he would work very hard so he didn't feel any emotion. And of course, memory was associated, and because he had lots of memories that he didn't want to, that brought back emotion, eventually he stopped remembering. And now to this day, 30 years later, he doesn't remember anything. Doesn't remember anything about his past, his childhood, apart from one or two things. So we're working on the process of him getting back in touch through letting go, through forgiveness, through allowing himself to experience sensations in his body, to bring back his memory. But it all relates to this idea of having a subconscious belief. Now this is, I want to tie this back into creating a document, because this is at the heart of the work of creating a document. Is the big question is, if you have these subconscious beliefs about who you are, like a placebo effect, if you believe them even subconsciously, then they just become real, they work. And so therefore it's really important to be able to excavate or uncover what those subconscious beliefs are, so that you can come back with the truth. So, for this guy, the belief was, I'm bad, I'm not okay, and it's definitely not okay to feel emotion. That's a subconscious belief he had. So in his document, if he was creating when he's creating a document, his document becomes about shifting that belief, that subconscious belief, and allowing himself to feel the pain and release the emotion first. Otherwise, the emotion just stays trapped. And so that's the first step in letting go and surrender and allowance, excavating all of those memories. But then he can move on to forgiveness. I forgive myself for judging myself, that I'm not okay, that I'm not loved. And the truth is, I am an emotional being. I am loved. It's okay to feel emotion. One of my I am statements is, regardless of what occurs inside or outside of me, I'm open-hearted, surrendered and free. So I just thought I'd share that. It's some interesting work I get to do, and it relates back to the deeper work we can do on creating who we truly are, magnificent human beings with infinite potential. Bye for now.